Hi, I am Laura Clay with Forward Emotion. I offer counseling, art therapy, and a process called EMDR. It is something that is a little bit misunderstood, and I thought that I could share some information about what it is. So it stands for Eye Movement Desensitization, which is a mouthful, therefore we call it EMDR. And it is an integrative psychotherapy approach that uses standardized protocols or steps by a trained master's level or higher provider. So I am a licensed clinical professional counselor. Other types of providers might be doctors, psychiatrists, social workers. It has been approved to treat trauma by many different organizations such as the American Psychiatric Association, the World Health Organization, the Substance Abuse and Health Services Administration, as well as the Department of Veteran Affairs and Department of Defense. It has also been found to be successful in treating anxiety, grief, phobias, and really any other type of issues that are founded in negative self-belief or negative thinking. A lot of problems that people have, such as low self-esteem, self-doubt, body image issues, those are all related in negative thinking. And EMDR helps to change that and get someone thinking more positively and therefore feeling more positively. An example could be somebody who is afraid of elevators. Somewhere along the line they became afraid of going into an elevator. Rationally and logically they know that most likely they're safe. There's nothing that's going to happen. It's very rare that something bad would happen in an elevator. But their body reacts as if something is imminently going to happen. They respond with fear, anxiety. Their body also may have symptoms such as a rapid heartbeat, sweaty palms, butterflies in the stomach, and those things are causing them distress in their life. So EMDR can target those issues and try to get them on the same line so that they're feeling better. There's a process for EMDR. It is involving several sessions. The first several have to do with history and treatment planning, and that's where I would take information, get to know a little bit more about what the person is going through, and we would really come up with a plan of what we want to target. We would think about a particular event or memory that signifies the issue. So for the case of the person afraid of an elevator, maybe there was something in their life, or there's another time that they get the same feeling, the same emotional and same physical reaction. And then we also identify that negative belief. So most likely with the person with the elevator is, I am in danger, I am not safe. And we use a process that could be done with eye movement, your eyes moving back and forth, or an auditory method, which someone could have a headphone on and their sound goes in one ear and then the other, and that is similar to the eye movement except that it's through your hearing. Or tactile, which is holding something in your hand that sends a pulse or vibration, and it sends that signal again to the other side of the brain, similar to the eye movement. That's called bilateral stimulation. And we hold together the negative memory or event. We think about the negative emotion, the negative feelings, and also that negative self-belief, and we repeat. Then we go through what's called desensitization. That's repeating until they're feeling better. And then installation is thinking about what would they rather feel. They would rather believe, I am safe, I am not in danger, I am okay, when they go onto that elevator. We make sure that all of those feelings are gone throughout the body, and that's the process of body scan. If, say, they're still holding something in their chest, feels heavy, we focus on that using the bilateral stimulation. And then once they get down to the place where we want them to be, we're having no reaction thinking about that particular memory or event, Then we go through closure, which is a relaxation technique, and ending our session. And with each new session, we do a reevaluation to check and make sure that those symptoms haven't returned. And if they have, we repeat. And if not, we move on or we end our work together. So that is a little bit more about EMDR. And if you have any questions, please post them below. I would be happy to answer them. I hope that you're having a great day. Take care.